Hello, I'm Chippy. And I'm here to talk with you today about chips. Not potato chips. Community health improvement plans are also called chips. Today, we're going to talk about how communities come together to improve health, and what that actually looks like in action. You'll learn what a community health improvement plan, or CHIP, is, why it matters, and how it helps us tackle the root causes of poor health using something called SMART goals. Let's get started. A community health improvement plan, or CHIP, is like a strategic roadmap for a healthier community. It's created by public health professionals, local organizations, and community members who come together to identify the most pressing health challenges and decide how to address them, together. A CHIP answers some big questions. What are the top health concerns in our area? What's causing them? And most importantly, what can we do about it? Once those questions are answered, the CHIP outlines clear goals, strategies, and action steps to move the needle on community health. It's not just a report that sits on a shelf. It is a working plan that guides decision-making, partnership building, and funding over the next 5 years. Now, to truly improve health, we have to look beyond the doctor's office. That's where upstream drivers of health come in. Think of health like a river. If we only focus on what's happening downstream, like treating illnesses, we're missing the bigger picture. To make lasting change, we need to go upstream, to the source of the problem. Upstream drivers, also called social determinants of health, include things like income and poverty, education, access to housing, transportation, food security, and even community safety and discrimination. These conditions shape people's health long before they ever see a doctor. Picture poverty, education gaps, bad housing, or even the air we breathe. These upstream drivers set the stage for who gets sick and who stays healthy. For example, if someone lives in unsafe housing with no nearby grocery stores or bus stops, they may struggle to stay healthy, even with good medical care. That's why a strong CHIP doesn't just focus on medical systems. It also takes aim at the root causes of health inequities, the upstream drivers, especially for communities that face the biggest barriers. To turn big ideas into real results, we need goals that are specific and measurable. That's where SMART goals come in. SMART goals help communities stay focused, track progress, and stay accountable. They also help funders and decision-makers see that a CHIP is more than words. It's a real plan with real steps. In June of 2025, more than 40 community partners joined the health department for 2 full days of conversation, voting, and planning. Together, 3 priority areas were selected that reflect both the data in the 2024 Community Health Assessment and the lived experiences of Summit County residents. Now that we've covered some background and shared how the CHIP work group came together in June, I'm excited to shift our focus to what came out of that work. I'll briefly highlight the 3 priority areas and their goals, priorities that form the foundation of the Community Health Improvement Plan and will guide our work through 2030. Priority 1. Strengthen partnerships to impact community health drivers. Summit County is full of passionate organizations working on housing, transportation, food access, workforce needs, environmental issues, and more. But the CHA made it very clear, we need stronger coordination, clearer communication, and a shared strategy to move upstream together. Goal 1.1 is to build an internal work group to understand social conditions that influence health, identify policy gaps, and collaborate on solutions. Goal 1.2 is to use existing partnerships and platforms to make it easier for residents to find resources, and to ensure those resources are accessible, equitable, and culturally responsive. In short, this priority strengthens the systems that shape health, not just the programs. Priority 2. Improve food and nutrition access for an evolving community. Access to affordable, culturally appropriate, and nutritious food looks very different depending on where you live in Summit County. Eastern Summit County, rural areas, and families with limited transportation face real barriers. Goal 2.1 is to strengthen our local food system by expanding infrastructure like community kitchens, mobile markets, food education, and climate-resilient local agriculture. Goal 2.2 is to reduce stigma around food assistance programs and build a more inclusive, community-centered approach to food access. In short, this priority helps ensure everyone in Summit County can access healthy food with dignity and without barriers. Priority 3. Increase immunization coverage to reduce preventable disease. Even with generally high vaccination rates, Summit County still has pockets where coverage is lower, and recent outbreaks in neighboring counties remind us how quickly preventable diseases can spread. Goal 3.1 is to strengthen vaccine confidence through clear communication, trusted messengers, and culturally responsive engagement. Goal 3.2 is to expand vaccine access by improving delivery models, closing geographic gaps, partnering with employers and schools, and preparing for future affordability and policy changes. In short, this priority reinforces one of our core public health responsibilities: preventing disease and protecting the community. Over the next 5 years, the Community Health Improvement Plan will guide the work of the Summit County Health Department across all programs and services, turning shared priorities into meaningful action. This moment marks an important milestone, recognizing the dedication and collaboration that made the CHIP possible, while also setting the stage for continued progress. The Community Health Improvement Plan is a shared roadmap for improving health in Summit County. Built using local data and shaped by feedback from community members, partners, and organizations across the county, it reflects what matters most for health and where working together can make the biggest difference. Looking ahead, this plan will guide public health efforts through 2030, supporting prevention, strengthening partnerships, and helping ensure everyone in Summit County has the opportunity to live a healthy life. Thank you to the Summit County community for your continued engagement and support.